Here today, we're going to talk about antibiotic resistance. And my name's Braden. I'm in microbiology, Bio 275 here at San Jose Community College, and this is for our homework 3 assignment. Um, so first, when we think about antibiotic resistance, it's important to really get a working definition of what antibiotic resistance really is. I kind of pulled from the Cleveland Clinic a working definition of what antibiotic resistance is. And they defined it as something when bacteria change so that antibiotic medicines can't kill them or stop their growth. So we know that antibiotics are meant to kill and stop the growth of bacteria. Um, to heal patients. So whenever bacteria become resistant, the antibiotics are no longer effective against the bacteria because the bacteria gain resistance to the antibiotics. It's really important to note that can become a really dangerous situation in healthcare because bacterial infections are very, very hard to treat if antibiotic resistance becomes a factor in treatment plans because at that point, you're kind of really going into a narrow spectrum treatment plan with your antibiotics, and you have to really target that resistant bacteria, and that's something that is not easy to do. It's also important to note that antibiotic resistance is something that's specific to bacteria. However, other microbes such as fungi, viruses, and parasites can also develop a drug resistance as well. Okay, and now the next topic is how do bacteria become resistant? So generally speaking, um, there's two genetic methods the bacteria can use to become resistant to antibiotics. And I believe I pulled these two methods from the NIH. I'll confirm this. I used my works cited here, but I'll confirm that at the end that it's from the NIH. Um, and so basically, the first method is that mutations arise in bacteria, which enables some of them to survive and thus develop a resistance. And then these resistant bacteria then reproduce and multiply, creating more of themselves, more resistant bacteria. The second method is that bacteria can actually acquire foreign DNA that carries resistance genes, and this occurs through something that is called horizontal gene transfer, or HGT, and this allows them to become resistant. So, just a little dive into HGT. There's three kind of sub methods to that I wanted to briefly touch on. The first is transformation, which is whenever um, DNA or bacteria can actually absorb DNA from dead cells into their genomes. Um, and the second would be conjugation, which is actually a direct transfer of DNA through sexual pili, which we learned about in class pili. And this is conjugation when they come into play, and that's your pili right there. The final is transduction, whenever a viral vector is used to transfer DNA between bacterial cells down here, this cell to this cell. And then another hot topic with this is how do doctors and other healthcare providers contribute to antibiotic resistance? And one major way that they do this is through overprescribing antibiotics or giving them whenever they're not needed. Sometimes doctors prescribe antibiotics for viral infections such as colds, flus, things like that, where an antibiotic's just not going to work. And this actually kills off sensitive bacteria but allows resistant bacteria to survive and multiply. And then after these resistant bacteria are created, or not created, but rather persist, treating future infections in that patient becomes really difficult because, like I mentioned earlier, narrow spectrum antibiotics are required to then target the resistant bacteria. Lastly, another topic is how do patients actually contribute to antibiotic resistance? One major way that patients actually contribute to antibiotic resistance is by not finishing the full course of antibiotic treatment or not following the treatment to plan. If a patient stops their treatment early, or like for example, they don't finish all their pills, if the doctor tells them to take two pills um, for 5 days and they stop at three, or they only take one pill a day, they risk the chance of actually leaving behind stronger, more resistant bacteria. And these strong resistant bacteria will then multiply and create more resistance. So it's really important that as a patient, you take the full prescribed course of medication so that it can be ensured that all bacteria are killed properly.